Good morning, ladies and gentlemen. This is Dr. Nehaz. I hope you guys are having a lovely weekend. So, this is a case that I did last week, a couple of days back, in my center, Smile Arts Maxillofacial Diagnostics and Implant Center, Kollam. The patient, Mr. Rajit, came to us a couple of years back with chronic periodontal issues, and he has been under care, under our care. Our periodontist had done a couple of flap surgeries and grafting and everything to save his teeth, but then we had to go with the difficult choice of removing a couple of his molars. Now it was time for us to rehabilitate them, and we ended up with a highly pneumatized and resorbed maxilla on the right side, where sinus grafting was one of the choices which we offered the patient, but the patient was not interested in either doing a sinus grafting, sinus lift, or zygomatic implant for that matter. So these were two options that we gave him, and the third option was to sacrifice a good tooth, which is the premolar, and the second premolar, the 1.5, and place a 22 long implant engaging the nasal cortex, and a second implant on the pterygoid. So this was acceptable for the patient, and yes, we went ahead and did the case as shown. A couple of more implants are to be planned for this case. We are planning to place a second molar on the second quadrant, and the molars on the fourth quadrant as well. So those implants would be done maybe in the next week. This was done 2 days back, and it was late evening, and we didn't have enough time to place all the other implants as well. So we went ahead and we fabricated surgical guides in-house based on the plan, and we executed it. So we have here the pre-op and the post-op of the case. It shows how precise the planning can be and the execution. The planning would have taken me probably half an hour. The guide fabrication designing would have taken me probably 5 minutes, and guide fabrication as such 1 hour. So in total, all this can be done in your clinic, and the accuracy is unmatched. So I hope you enjoy seeing this case. We achieved very good primary stability, and we are planning on going with an immediate load provisional processes for this case. You can see that we have taken the intraoral scans with the scan bodies as well. All right, guys, have a lovely weekend and stay well. Bye.